fusion.
And so question, your flow rate numbers, how
Yes.
are they calculated and what are they based on?
Yep. So we're using the single tissue compartment model that was popularized by Dr. Rob DeKemp from Ottawa. We're using an 8mm sphere for the arterial input function or the atrial input function. It's auto placed at the point that has kind of the maximal counts as the blood is entering. We kind of recognized early on that it was important to get the atrial input function at a good place where you're getting the best sampling, and we felt like auto placing that was the best way to do that. We also are doing some quality control on these curves to give you a good idea of, is this a good flow study? It's fairly easy to acquire a flow study. It's really difficult to acquire a good flow study. Starting the scanner at the right point, making sure that everything has been done properly. And so that's what we were trying to do by the QC. So looking at, was there possibly scanner saturation, or did we miss the blood peak? Or is the blood peak width wider than we expect? Is there a flat curve at the end that would indicate there may or may not have been motion? Is there gradual or abrupt motion? How was the fitting? So, from all of these curves, we actually are fitting points, and did that fit happen well so that we know that the numbers that we're getting we can trust. And so again, that's all from this table here at the bottom. We're using an 8mm sphere. There are other, I think, packages that are using cylinders instead, and if you would like to do that, that's an easy fix. I can either change it on the fly. So down here where it says a sphere of 8mm, I'll change that to a cylinder. We'll go back, and now we're recalculating it as a cylinder. You'll see that the numbers change. That's to be expected because now we're averaging a much larger area for the arterial input function. When we average a much larger area, that average drops a little, and flow is flow is the division of the tissue divided by the sum of the atrial or the blood input curve. And so since that average is smaller, we're dividing by a smaller number that causes the flow values to get a little higher.